Hi, welcome back to the Medicare Show. I'm your host and Medicare advisor, Jeff Kuhn. Got an interesting episode today with some changes with Medicare that are coming for 2027. 2026 was probably one of the biggest changes we've seen in a long time, but some of the numbers are coming out for 27, so I've got that information for you today. If you want to get more updates for some of the changes for 27, please take a minute and subscribe to this podcast, and would certainly appreciate you liking it as well. Some of the numbers that are out, some are projected, some of these numbers are finalized, but what's interesting is kind of the story it tells, because we all talk about costs and we talk about paying for Medicare, and people kind of underestimate the cost of Medicare increases each and every year when you're planning for retirement. So you want to be careful making assumptions. You know, people think they've paid into Medicare, it should be free. They're not planning on the constant increases, and where those increases are coming from was really what's interesting. I've kind of broken down the numbers for you so you can kind of take a look at what's happening for next year. And it's going to be interesting to see what gets put out there in the news. I'm not saying politically, but with the real numbers and where the costs are coming from is pretty interesting. It's pretty clear. I'm going to go through a couple of them with you here. Most people don't have just Medicare Part A, which is your inpatient hospital coverage. When looking at increases, just assume you only had Part A and you're inpatient. This year it's a $1,736 deductible. In 2027, it's projected to go up to $1,788. Now, that's not a final number, but when you look at the $52 difference, it's only about a 3% increase. Not a big deal. When we look at Part B, and that's usually the big one that most people are going to take a look at, that's your medical benefits. So Part B has a standard deductible. Again, assuming you've got just original Medicare, non-Advantage plan. You may have a supplemental plan that has a Part B deductible. The increase is going to go from $283 up to about $292. Again, this is projected. It's not a final number. Not bad. It's only 3.2% increase. That's not where the hidden costs are. That's coming. When we start looking at the deductible for Part B, saying it's 3.2%, where is the cost? Where is that going to be embedded in with these plans? Well, it's going to come in a couple places. When we look at Medicare costs, for most people, the biggest concern is your prescriptions, that Part D. So there's a couple places we're going to see some embedded costs for 2027. And these are not projected numbers, some of them, they're finalized number. But what is projected, they call your base monthly premium for Part D. They look at the national averages with these. So 2026, it's $38.99, going up to $41.33. So that's about a 6% increase, and that's a base monthly premium. Now, we've seen drug plans as high as $200. Doesn't mean your drug plan is going to be set at that number. The max deductible for prescriptions, this is where we're starting to see some of the biggest changes. In 2026, the max deductible an insurance company can charge you is $615. Where is that going? It's going up to $700. What's really interesting is that's where people are going to feel it. It's an $85 increase, but as a percentage, this is where the costs are sort of hidden. It's a 13.8% increase year over year from 26 to 27 and what you're going to pay in a deductible. Why is that important? Well, also there's a max out-of-pocket threshold. This is part of the Inflation Reduction Act. Everybody knows they're paying more for prescriptions. The out-of-pocket max is $2,100 this year. Where is it going to be in 27? It's going to go up to $2,400. That's a $300 increase, and that's over 14.3% increase from 26 to 27, your out-of-pocket max. Those two things are really important, your deductible and your max out-of-pocket. So what's that mean for the consumer? You're going to be paying more for prescriptions next year. How do you mitigate it? I've talked about in prior episodes Medicare's prescription payment program. And as a reminder, you've got to sign up through the insurance company that you have your drug benefits, your Part D through. So when you start off in January, as long as you've signed up for this, you don't have to pay that deductible in January. You can spread it out over the course of the year. So from $2,100 out of pocket max, and we're going to include the increase in your deductible up to $700, that $2,400 out of pocket max. What does that mean numerically for you? For those of you that are maxing out your drug plan in 26, you're paying around $175 a month this year. For next year, you're going to be paying $200 a month. That's the monthly increase in cost that you should expect. But do not assume your prescriptions are going to be in formulary or be covered the same next year. We had a lot of people call and wonder why their drugs that were free next year now have a $5 copay with them. Some prescriptions are going to go up. They've gone to co-insurance from copay, so you want to pay attention to this. Now, what we know about Medicare Advantage plans and what we're hearing, we're going to be waiting for the final numbers on this as they come out in September. But there's going to be a reduction in some of those extra benefits. You want to look at your annual notice of change as it comes to see what's changed year over year, that side-by-side comparison from 26 to 27. But what we're hearing is some of those extra benefits, whether it's eyewear, dental, there's things that give you meals, transportation. There's going to be a reduction in that as companies are trying to increase their margins. We've already seen insurance companies like Humana announcing they're going to be reducing their footprint in certain non-profitable markets. So we're looking at saying, where is that going to happen? Where is Humana going to reduce? But you want to look at your benefits. Don't be surprised in 27 if you don't pay attention to this and there's changes again, because there's going to be changes. We know they're coming. We're waiting to see what they are. But for the facts right now, we do know that you're going to be paying more for prescriptions in the form of a deductible and your out-of-pocket max. Some of the others things aren't changing as much, but you're definitely going to see a big increase in what you're paying out for your prescriptions next year. So stay tuned. Please subscribe to this if you want some updates as they're coming available for 27. But we know that these are some of the first things that are out there, and we hope you found this information useful. Again, please like and subscribe to this podcast. I do appreciate it. Thanks for joining me today. Bye-bye.